Hello, and thank you for joining today's webinar. We will be getting started in 1 minute. Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, we will have time for a question and answer session. You'll see on your GoToWebinar control panel that you can send a message through the questions feature. This is where you can type in any question you'd like to pose to the presenter. Be sure to hit send so the message makes it to us. To test out this feature, please submit the state or country you are from. On behalf of Sigma, we would like to thank our speaker for sharing her expertise with us today. Our speaker is Dr. Lois Marshall. Dr. Marshall, a nurse educator for 40 years, has held a variety of faculty and administration positions while at the University of Miami School of Nursing, where she has taught for 26 years before leaving to pursue a consultative career in nurse education, evidence-based practice, research grants, and career development management. She has received numerous awards for her teaching throughout her career. Dr. Lois Marshall holds a BSN from the University of Miami, an MN from Emory University, and a PhD in higher education from the University of Miami. Dr. Marshall's doctoral dissertation focused on variables that predict success on a licensure examination for registered nurses, and she developed an NCLEX review program focusing on unique testing strategies, linking and conceptualization to assist the studying and testing needs of all new nursing graduates. She has traveled across the country as well as worked online to provide assistance and intensive mentoring to students in the area of test taking and licensure preparation for the entirety of her career. Now let's go ahead and turn the presentation over to Dr. Lois Marshall.
Hi, good morning to everybody. I hope everybody can hear me. I'm glad that you are on. If you've never been on one of my webinars before, I welcome you for the first time. And if you have been on one of them, I welcome you back. I'm always very excited to do anything having to do with NCLEX prep, and particularly during this time when your lives may be a little upside down, helping you get ready for your licensure exam. So for those of you that have never been on a webinar before, or my webinars before, through Sigma particularly, I got lots of questions that were asked of me to redo some of my test taking strategies, which I did on the very first one. So I'm going to spend about 30 or 35 minutes around there going through some of the test taking strategies that are very unique to me and things that I've developed over time that are my copyrighted strategies. And then we're going to spend the rest of the time just doing practice questions. And we have several, I have a whole bunch of test questions that we'll go through, some of which we will have you actually log in your answers. And then some of them you can just write answers down and I'll go over them. I'll show you why it's theoretically correct. And then if there's a strategy, particularly that you could have used to help you get it, then we'll go over that as well. So just to start, there are just some general things to remember about the boards. And it's really, really important for you to take stock of these. One is to read carefully. And I know it sounds so easy. Oh, well, yeah, of course I'm going to read carefully. But one of the things that you need to remember is that when you're nervous, which you are all going to be, anybody who tells you you're not going to be nervous taking your boards is not telling you the truth. You're going to be nervous. If I had to go take them again, and I've been a nurse for 42 years, I'd be nervous too. So you need to read carefully, and it's not just read the question or read the scenario. You need to read from the beginning to the end of every sentence and the beginning to the end of every option. Because often what you'll see, and many of you may have seen this in practice things that you've been doing already, is that a lot of times the information that is most relevant to the question or to the answer being right or wrong is at the end of it. And so if you see something at the beginning that looks good and you just press enter and you move on, you may have missed the important information that was at the back end of the scenario, the question, or the options. So make sure that when you're practicing that you're reading really carefully. Second, you want to use, as a general rule, process of elimination should be your friend. A lot of people will tell you that, oh, well, just look for the right answer. And that's fine if you know the right answer. But if you don't know the right answer, how can you minimize your chances of getting it wrong? And one of the ways to do that is very simply by using process of elimination. If you know something is wrong, then get rid of it. And I'll go through some things that will help you determine when you can eliminate something. So use process of elimination to help you when you are unsure of something. It's a lot better to pick from 2 answers than it is from 4, or even 3 answers than it is from 4. Okay, and that's particularly for a multiple choice question. And then you want to make sure, particularly for me, to use what you know to assist you with what you don't know. So that's where it comes into linking or conceptualizing. That is, if you learn something once, use it for as many things as you can. You know, in layman's terms, we say get more bang for your buck. That's exactly what this is. If you know about a particular health alteration, then you know it. You know, what can you use it for other things? So if you understand when someone is bleeding, then you understand bleeding for every patient that may be bleeding. If you understand pre-op teaching, you understand it for everybody that's getting pre-op teaching, with the exception of maybe the age or maybe the surgical procedure, and there's something very specific. But the general information is the same. For congenital heart defects, if you know acyanotic heart defects, there are some assessments that are the same for all of them. So if you know it for one, you know it for more. So when you get stuck on a question, you want to make sure that instead of having a panic attack, that you just take a deep breath and you look at it and you say, okay, what do I know? What can I link this to, or what can I help myself with in order to get the best answer? And you know, about 85% of the time, if you do that, you're going to be right. And if you're right 85% of the time, you're going to pass the boards. And that's the goal. Okay, now these are general strategies. These don't have anything to do with my particular specific copyrighted strategies, but just in general, really quick, I just want to go through these if you don't know them. One, remember this is a theory test or a book test. It's not a practice test. So try not to answer things as you've seen in practice. Answer things as you know to be theoretically correct. And when I go over questions with you, or if I'm working with people one-on-one or in groups, I make sure that they know the theoretically correct answer first. And then, yes, there's a strategy, or yes, you might have seen this in practice, but it's not necessarily how to answer the question for the boards. This is not a practice test because all of you have practiced in entirely different clinical settings, okay? And remember, this test has to be the same questions that can be pulled for anybody. Make sure that when you're reading options, that you pick non-pharmacological interventions before pharmacological ones. So if there are 2 answers that you say are equally good, and one is pharm and one is not, pick the non-pharmacological intervention first. There are many, many new grads who jump to medications first. That's not theoretically the way that we want you to answer test items. So now, will it change in some instances? Yes. If it's an emergent situation, if it's a crisis, if the patient's in critical condition, yes, then you may jump to the pharmacological intervention, but that's based on what the question is telling you or the assessment that you're reading or that you note. But in general, pick non-pharmacological interventions first. The same goes with non-invasive. So you want to pick non-invasive interventions before you pick invasive ones. You know, do everything that you can non-invasively first. Expected versus normal. Make sure that you have a good understanding of the difference between what is considered normal and what you expect to see. Okay, so I always give 2 examples for this to sort of remind you of this. It is expected. It's expected that someone with chronic obstructive pulmonary disease has respiratory acidosis. Okay, it's expected that they run slightly acidotic. knowing that does not make that normal. So if you got a question on a practice test or on the boards, or an exit exam if you're still doing those, and it gave you a question about someone with COPD, and it gave you an ABG that showed respiratory acidosis, and it says, what do you do? Don't just pick document the findings. Make sure that you pick an answer where you are either alerting the physician or documenting that respiratory acidosis is present, not that this is normal just because it's expected. Okay. Another example of that is if you have a question about someone who is suspected or is worried that they may have breast cancer, we expect that women at certain points in their cycle or their menstrual cycle are lumpy or have lumpy, bumpy breasts in layman's terms. Okay, we expect that, but no lump is ever normal. Okay, everybody who finds a lump that is out of the ordinary for them, which is why you do self-breast exam, needs to call the gynecologist, the clinic, or whatever on a board's question. So make sure that you have a good understanding about what might be normal, really normal, versus what might be expected. Just because it's expected doesn't turn it around to be normal. And just to extend that one other point, make sure that when you answer questions on the boards, that you're answering them about patients, not about your relatives. Okay? Just because your relatives have something doesn't mean that that's the norm or that that is even what is expected in most patients. So your family members are different than the patients that we are describing in boards questions or on practice questions. So be really cognizant of those kinds of things, because when you're nervous, you tend to, and we all do this, including me, when you're nervous, you tend to go back to what's comfortable. And so what's comfortable is, my relative has diabetes mellitus and this is what they do, so everybody must be able to do that. That's wrong. Okay. When you see the age on a board's question, it's relative to how you answer the question. They don't put the age in unless there's something that they want you to gravitate to. So whether it's the age by number or the age by group, like a toddler or an older adult, then it's significant. If there's no age, then you can assume, so one time I tell people to assume anything, that they're an adult, that they're asking a question about an adult. And most of the questions on the boards are about adults. But if the age is there, it is significant. So make sure that you pay attention to it. Okay. And then absolutes. So these are one of those things that can help you eliminate questions. So remember I said that there are some things that you can use process of elimination for. So absolutes are those words that say something is always, there's an absolute, like something. Okay. There is nothing in practice that happens the same way every single time. It's because every patient is different. Everybody's history is different. So if you see things on the boards that use the words like every, always, none, never, okay, always, every, none, never, those kinds of words, only, if you can eliminate them, the chances of you getting the answer right are much greater. And so usually I have students or new grads ask me all the time, they get it down to 2 answers and then they don't know what to do. If one of the 2 that are left has one of those absolutes in it, I generally tell people eliminate that one, because the chances are less likely that that's going to be right, okay, and more likely that it's going to be wrong, and then just pick the other one, okay, even if you're not sure. Okay, so one of the things that you have to learn when you're practicing is to give yourself permission to pick something that you're not sure of when you know the other 3, again, in a multiple choice question, for example, are wrong. If you know 3 of them are wrong, you're actually smarter, okay, than if you only know that 1 is right. So look at the absolutes for that, okay, and make sure that you pay attention to them. Now, sometimes the absolutes will be written in more of a negative format, meaning they're telling you not always. Okay, that's a different way to look at it rather than always. Okay, so use the absolutes to help you. Okay, call the doctor. One of my favorite things to discuss in any NCLEX review is please remember that the smartest people on the healthcare team are the nurses, okay? Not the physicians. The physicians are smart in the area of which they are experts in. We are smart in all areas because we manage everything about a patient. So on the boards, this is a nursing exam. It's not a physician exam. And it's not a let me call the doctor exam because I don't know. You only want to call the doctor. See, and there I used an absolute. So you generally want to call the doctor when it is a medical emergency. Okay, so hemorrhage, things that have the word status in them, like status asthmaticus, status epilepticus, anything with increase intracranial pressure, increased intraocular pressure, things with crisis, myasthenic crisis, things that have storm, thyroid storm. So things that have words that capture the urgency or the medical emergency. If you have a question that has that, then you can call the doctor. But first, make sure that you have all the information that the doctor is going to ask you. Okay, so if you're left with two options, or in a select all that apply, you have several options, and they all say they're asking you to collect or assess information that the physician would ask you when you call them. Do that first, and then call the doctor. If the information that you would need to give the doctor is in the scenario, then go ahead and call the doctor. Don't do anything else. So for example, if I gave you a question about someone who had a transurethral resection of the prostate, okay, and on the boards it doesn't say TURP, okay, it's written out. So, and they're getting continuous bladder irrigation. And in the first 24 hours, you've assessed the urine and it is bloody, which is what we would expect because it's transurethral, the bladder has lots of capillaries, the renal system is very bloody, patient's going to have bloody urine, okay, or hematuria. You take care of the patient the next day and it is pink, which is what you would expect from continuous bladder irrigation because you're continuously irrigating the bladder, clearing out the blood, okay? You go back the next day in 72 hours and the urine is bloody again, okay? If one option is to call the doctor and another option is to collect their vital signs, then get their vital signs is the answer, even though your gut is telling you to call the doctor. Because what's the first question the physician's going to ask you? What are their vital signs? So if that's an option, then pick that. If that option's not there, so in the scenario that I gave you, if it said that you've already assessed the client and their pulse is rapid and thready, and their blood pressure is decreased, what do? Then that information you've already collected, now you can call the physician. So you want to practice with these if you can see them and just make sure that you're not missing them. Because again, when you're nervous, your gut is call the doctor. And 9 times out of 10, that's not the right answer. Okay. Okay, priority setting. I get a lot of questions from people about priority setting. And it's not that you all don't know how to do it, because you do. You've been doing it. And even if you didn't have clinical this last semester of school, or your last semester is coming up, just because you haven't been in practice for a little while doesn't mean you don't know how to priority set. Okay, so just remember Maslow. And if you can remember Maslow and you know and understand what you're looking for, then you should be able to get every single one of these right. Okay, you should be able to get them right. Okay, so is there an ABC issue? Okay, so is there an airway issue? Is there a breathing issue? Is there a circulation issue? Okay, I on the slide where it says this is not the same as for CPR, don't get confused. Remember, CPR is now CAB, and so we do circulation first. I just remind you of that again, because when you're nervous, you think in the way that's comfortable for you or the thing that you've memorized. And that's why memorization is not the best way to study for the boards. It's to try to learn and conceptualize the things that you are and critically think through the things that you need to know. So is there an airway? Is there a breathing? Is there a circulation problem? If yes, then that's the priority. If no, then go to the next one. Are there other physiological issues that you need to be concerned about? And then they become the priority. So is the patient having pain? Okay, that, remember, in our practice, pain is the fifth vital sign. So if someone has pain, that is a priority in other physiological. And then you can look at other things. Is there dehydration? Are there other physiological things that you would want to prioritize? If no, or if the question says there aren't any, then go to the next one. Are there safety and security issues? Okay, so they could attach those to any patient. You know, is it a safety issue related to a particular health alteration, like the epileptic who's having a seizure, a psych mental health patient who maybe is having hallucinations and is of harm to himself or to someone else? Okay, is it someone who's threatening to commit suicide? So is it a child that the side rails are down and they're little? So are there safety and security issues? So for some people, safety and security is the priority. And then if no, go to the next one. And then that's love and belonging. And that's all the psychosocial things that nurses really love to do, but gets prioritized at the back end of a lot of these things. Because remember, our patients are in a hospital, they're generally sick, and they generally have something that is physiological going on with them that becomes the priority. Okay. The other thing about priority setting to remember is it's actual before risk. So if someone has an actual issue and someone has a risk for something else, it's the actual one that becomes the priority. So for example, if you had a patient who was at risk for some type of a breathing issue, but they actually had a pain score of 9 out of 10, and that was actual, then the pain is the priority over the risk for the breathing issue. If, though, the patient had an actual breathing issue and actual pain, then the breathing comes first. So it's just getting used to looking at it this way. And more new grads think that these are really hard questions to answer. They're not if you stick to the same concept. And the concepts are ABC, other physiological, safety and security, love and belonging. If you stick to that mantra, actual before risk, you're going to get the majority of those questions right. Okay, it's just telling yourself you can do it and being your own cheerleader. Now, if you want to imagine me in your head, which probably for most of you is not the best thing to do, but if you wanted to, just hear me telling you, you can do it. You know this. Just think it through. Take a breath and think it through, and you'll get the majority of these questions right. Okay. Also remember, with priority setting, there's no right way to do every single patient. And I always use as an example sickle cell for this. So if you get a question on the boards about sickle cell anemia, in school, lots of times people learn, okay, well, you're going to look at oxygenation, and then you're going to look at pain, and then you're going to look at hydration status. And those are the three things we generally look at with someone who's in a sickle cell crisis. Okay, now there's no correct order for that. If you followed this and you picked oxygenation, pain, and then hydration status, and then you went back and you looked at the assessment and it said the patient had no evidence of shortness of breath, dyspnea, difficulty breathing, gasping for air. Okay, they had regular breathing patterns. They had pain of 2 on a scale of 1 to 10, but they had signs and symptoms of dehydration. Then hydration becomes the priority, not the breathing that they're not having difficulty with, or the pain that's only a 2 on a scale of 10. Okay, I can change it and make pain the priority. I can change it and make breathing the priority. So what's the actual issue? And then what is the information that's in the question telling you? And that's how you answer these. And just keep going through it every time you see the word first, priority, initial, immediate. Those are words to sort of say, okay, what is Maslow telling me? What am I going to do? Okay, delegation. These questions for most new grads are not as difficult as you think that they are. The issue that most new grads have when they're taking the boards about delegation has to do with what you've seen in practice versus what's theoretically correct. So remember that because this is a book test or a theory test, you have to answer the question not like you've seen. And we know that in almost every clinical agency where somebody has practiced, had clinical, or if you've worked as a CNA or a nurse tech or an intern of some sort, that a lot of times leeway is given to nursing students. They, nurses let you do more than you're supposed to because they know that you're in nursing school. Some places let nursing assistants do things because of the environment. So for example, in Florida, nursing assistants in long-term care facilities can give meds, but on the boards, we wouldn't have CNAs giving meds, okay? Because that's a state law or a state statute. It's not the general theoretical way to do things. And there are some places that have different rules or different policies. So you want to answer these questions as they are theoretically correct. So a couple things to remember. First, it's an RN exam. It's not an LPN exam. It's not a nursing assistant exam. It's not an intern exam. It's not a residency exam. It's an RN exam. So if you don't know something, err on the side of it being your responsibility. Okay. It's better to err on an RN's role or RN's responsibility than it is to give something that is absolutely an RN's responsibility to somebody else. So just make sure that you err that way if you're unsure. Again, I've gone over the theory versus practice. Make sure that you understand scope of practice and competence and what knowledge is necessary for somebody to do something, okay? And then probably the most important thing is to compare all the options before choosing, because different phrase questions may have different answers and the options may dictate to you what to choose. For example, if 3 things you know are RN, they're completely complex, critical, only an RN can do them, whatever's left has to be the right answer, even though you may not think that in a theory or even a practice world. So just be careful that when you get a delegation question, you read everything, really read everything to make sure that you're comparing the options, because sometimes something that I might tell you is not theoretically correct, maybe the only thing there. So I'll give you an example of that. If you got a question about somebody, a certified nursing assistant, who is supposed to do intake and output, patients on strict INO, and the CNA is doing the INO for you. In theory, so if you took theory to the nth degree, in theory, CNAs are not supposed to do INOs. So now everybody on the call is going, oh, CNAs do INOs all the time in practice. Absolutely. And there are lots of places that they do. How do they do that in practice? Because the RN tells them, if you get this, come report it to me immediately. So with the assignment of doing it, there's an education that the RN has to give them because they don't have the knowledge of when something is good or when it's bad and needs to be reported. So it's the responsibility or our accountability to teach them that. So that's how we get around a lot of these things in practice, by saying, please do this, but if this happens, come tell me. So if you go back to the question I used before of the patient who had continuous bladder irrigation, if I tell the CNA to just go get me an output from the bag, and I don't tell them to note the color, and if it's bloody, come and tell me, and they see it bloody and they don't do anything and the patient bleeds out, you are both accountable and responsible for that error. So on the boards, you want to make sure that if you're delegating, that the person that you're delegating to, you give them that information. Now, that being said, if there are 3 other options, as I mentioned before, that are all critical, and that's the only one left, then you might have to pick it. So this is an area where you just have to be a little flexible with yourself and just read really, really carefully, okay, to make sure that you are understanding what it is you're delegating and how you're doing that. Okay, that did not go. Okay, so just briefly, just to go through these. So the nursing assistant in general is by theory, beds, baths, feeding assistants. Okay, there are exceptions to the rule. I just mentioned that. And you have to be careful what kind of patient you're assigning them to. So, you know, you wouldn't want them feeding a patient who's had a stroke because they might not know about aspiration. You wouldn't want them feeding a patient who's got myasthenia gravis or who's got cerebral palsy or muscular dystrophy or some other kind of neurological issue where the gag reflex might be impaired. So using some of those to say, okay, yes, they could normally do this, but not with this particular kind of patient. So just use those. Most nursing aides or nursing assistants, beds, baths, or hygiene, and then some kind of feeding assistance. Licensed practical or licensed vocational nurses. On the boards, it usually says licensed practical nurse. Basic nursing care and treatments that are non-complex, okay, non-complex. Medications, yes, but no IV push, which is IVP there. No blood products, no chemotherapy, no central lines. Okay. And then the LPN, no initial assessment, teaching, or evaluation. So in practice, how do we get around that? We do the first assessment, we do the first teaching, we do the first evaluation, and then we have a conversation with the LPN, and then the LPN can go and follow up. They cannot, by theory, do anything initial, okay? So that's the LPN. And then there's us, okay? So basically everything else, okay? Everything complex, everything that takes critical thinking skills and functions that requires the most knowledge, the most education. So assessment, initial, especially. Teaching, initial, especially. Evaluation, initial, especially. Interpretation of labs, okay? Medications, okay? So the IV push meds, the chemotherapy, blood products, central line. All of those are our responsibility. Verbal orders, telephone orders, DNRs, all of those are responsibility. And again, if you're unsure, err on the side of us, okay? Err on the side of the registered nurse to do those things. Otherwise, that's basically how you break it up. So delegation questions, there's a large number of them in the pool of questions. It doesn't mean that you're going to get more than one or two. So don't worry about it. Don't worry about the questions that you're getting on the boards. Okay, so just, because I'm thinking of it, let me just let you know that. I had a lot of questions this week from people that are following me online, and I'll give you all that information at the end if you don't have it already, about select all that apply. And if I'm getting a lot of select all that apply, does that mean I'm passing? And if I don't get a lot of select all that apply, does that mean I'm failing? It's a myth, okay? There is no way for you to determine your success or lack thereof based on the questions that you're getting on the boards. Forget all of that. All you need to do is say, as long as I have a question in front of me, I am passing. As long as I have a question in front of me, I'm passing. And just keep that going until you get to the point where the computer shuts off. There's no way to determine, based on the type of question that you're getting, whether you are passing or not. The computer has a system of which it uses to adapt the test to you. And the same content can be gotten in a select all that apply as it can in a multiple choice if that's what the computer pulls out of the pool of questions. So don't try to second guess the computer as it's giving you questions, because one, it wastes your time and it's a time test. And two, it makes you twice as nervous as you already are. And you don't need to be any more nervous than you are. So just don't worry about it, okay? Just forget it. Okay, so then these are some more focused strategies of mine. I'll go through these for you. I will also Megan, I know you're on the call. Can you just write yourself a little note to remind me? I have a handout that I can send to you that you, if we can attach it to the file when they get it for the audio and stuff, and I'll send it. And these will all be written down with some specifics in them so that everybody can have it if they want. Okay, so these are mine. Okay, these are things that I've created over, you know, my 40-something years of doing NCLEX stuff that are very unique. And they are strategies to be used when you don't know the answer to something. If you know the answer, just pick it and move on. If you don't know the answer, then you want to use these strategies to sort of help you along the way. And so these are mine that I used as part of my dissertation and also that I've copyrighted along the way. So I'm really into numbers. I think that in practice, we use numbers for a lot of things. The most common number in clinical practice for registered nurses is the number 2 or some variation of that. So 2, 20, 200. There are lots of things that we do that have a 2 associated with them. So if you are stuck on a question on the boards and they're numbers that you have to pick from, or something is number related and you're not quite sure what to do, pick an answer that has a 2 in it as a best educated guess. Again, I'm not telling you to use this in lieu of your knowledge or in lieu of your critical thinking. I'm saying if you really don't know and one of the answers there has a 2 or a 20 or a 200 or something associated with that, at least it's a good educated guess. These strategies that I'm telling you work 85% of the time. So again, I've tested them. I know they work. I'm not going to teach you anything that's going to hurt you. I've been using these for a long time. They're very successful. So if it works 85% of the time, then try it. Okay. Now these are on NCLEX questions. So if you're practicing in something that isn't the best well-written NCLEX practice questions, these might not work. But you can try them and you'll see that in most cases they do. And if you think about the things in practice that have a 2 associated with it, you'll see why it works. So we say digitoxicity is 2.0 and higher. Okay, so that's a 2. We don't say, oh, well, everybody that is out of therapeutic range has digitoxicity. We clearly look at the assessments. We want to know if they have halos. We want to know if they have headaches. We want to know if they have nausea. But we also look at their dig level. And if it's 2.0 or higher, then that's considered digitoxicity. So that's an example. Lithium toxicity is the same way. Okay, 2.0 or higher lithium toxicity. So that's another 2. Okay, serum creatinine. We don't worry about someone's renal function unless their serum creatinine is 2.0 or higher. Another 2. Okay, so I'm a nerd and I look for these things. How many liters of oxygen do we give patients? As a general rule, because on the boards, if they're going to ask it, it's usually about someone with COPD, we don't give more than 2 liters per minute. Okay, so that's another 2. Okay, how many days after you've done a Mantoux test or PPD do you read it? 2 days. Okay, if you're teaching somebody how to crutch walk, and you're trying to tell them the distance between the axilla and the crutch, and you want to know if they understand that, it's 2 inches. So there's another 2. Okay. If you're looking at someone who's got a cast and you want to see if it's too tight, you should be able to get 2 fingers into the cast. Okay. Most shock, so hypovolemic, anaphylactic, neurogenic, or spinal. Septic, all abate in about 2 days. So another 2. So again, I'm just giving you examples so that you can see this actually does make sense. Most psych drugs take 2 weeks to work. There's another 2. Heat therapy or cold therapy should generally only be done for 20 minutes. That's another 2. Okay. Your cholesterol level. Okay. If it's above 200, then that's something to be concerned about. That's another 2. Okay. We turn patients every 2 hours. So that's just some examples, but you can see that, again, it's used so much in practice and we have it as something that we use all the time, that if you don't know the answer, it's a good strategy to use. Okay, so that's an example of the number 2. Most therapeutic drug levels are in a range between 10 and 20. There's another 2. So if you got a question on the boards about a therapeutic blood level and you don't know what it is, pick something between 10 and 20. And, you know, about 85% of the time you're going to get it right, because most of them fall into that. Most patients who have increases in intraocular pressure, it's above 20. A normal ocular pressure is between 10 and 20. So if you got a question about someone who is going to get tested for glaucoma, and they tell you in the right eye it's 16 and in the left eye their ocular pressure is 18, what do? Document the findings, because that's normal. Okay? And it's the same for intracranial pressure, is also between 10 and 20. So again, it's just it's me looking for common things to help you when you don't know the answer to something. Okay, the range of 4 to 6 works for time. We generally check patients every 4 to 6 hours. So if you think about that and you have a question where you need to time something, you need to go in and do something to a patient, we generally, minus turning, we generally do it on an every 4 to 6 hour basis. So if you don't know and there's an answer like that, pick it. And then most numbers end in a 0 and 5. So as a general rule, if you get a question that's number associated and it doesn't have a 0 or 5, like it ends in a 3, that's like an odd number. Don't pick that. Okay, so just use these to help you when you don't know the answer to something, and you're going to get them right a much greater percentage of the time than you're going to get them wrong. And that's what you want to be looking for in order to help you with these things. So an example that I give a lot for this is if you have not memorized the immunization schedule, and I'm a peds nurse, and honestly, I don't care if you memorize the immunization schedule, because it's sort of, it is or it isn't. And most kids, when you're trying to teach their parents it's because they didn't start on time. So I'm not really interested so much in that you know it, but just to show you how this can work. If you think about most kids and their immunizations, most of them get immunizations at 2 months, 4 months, 6 months, 12 months, 4 to 6 years, and 12 years. Okay, that's the general time frame for immunizations. So if you got a question on the boards about that and you panicked and you said, oh my God, I can't remember it, and Dr. Marshall said I didn't really need to know it, and oh my God, I don't know it. Okay, then look at the options and see, do they have a 2, a 4 to 6? Look for those things. And if there's a common number that I've just described, then leave those in and get rid of everything else. So if it has a 7 in it, get rid of that answer. So you've eliminated that. If it has a 9 in it, get rid of that, and you'll have eliminated that. If there's an 8 in it, get rid of that. And then if you're left with something, you'll see that it'll be right, because 2 months, 4 months, 6 months, 12 months, 4 to 6 years, and 12 years has 2s and 4 to 6 in it. And you'll get it right. And all you needed to know was a strategy to help you when you started to panic, and you'll get the right answer. So that is my job, is to help you find ways to be successful test takers when you don't know the answer. My job is not necessarily now, as much as I would love to teach all of you, you don't want to go to nursing school again. So that's the role of this kind of a strategy. And I love it. I get more feedback on my strategy, on these particular strategies, than I do anything else from new grads. Okay. This one I probably get the most feedback about, and those are the pharmacological strategies, you know, and how to answer pharm questions. The first thing you need to remember is it's not a pharm test. Now, obviously we spend a lot of our time giving meds in practice. So just make sure that you have some general understanding of the more common drugs that are used. But remember, it's the theoretical drugs that are used, not necessarily the latest and greatest drugs that you've seen in your practice setting, because remember, what someone might have experienced in giving in the county hospital in Miami may be very different than someone who lives in rural Missouri, where they don't have a big academic center in the middle of where they live, and they might not have seen those meds. So you're looking for meds that are more common. Okay, to the theoretical world rather than the practice world per se. Okay. So an example I always give is if you had a person who had a ventricular dysrhythmia, so VTAC, VFib, PVC, or premature ventricular contraction. If you had any of those where ventricle is in there, okay, it doesn't say sinus, so it's a ventricular dysrhythmia. A lot of you would pick adenosine if you could see it on the boards, because that's what a lot of people see in practice. But usually that's not an option on the boards. If it is, pick it, because that's the drug of choice for most patients. But a lot of times the answer will be lidocaine. And people ask me all the time, well, lidocaine, I don't give lidocaine for ventricular dysrhythmia, but that actually is the drug of choice in the theory world outside of what everybody might be used to seeing in practice. So if adenosine is there, then give it. Or if it's a select all that apply, then pick that. But lidocaine is a more commonly asked drug on the boards because it's more commonly known across all 50 states where people would be taking boards. And thus, it would be in the pool of questions. So that's an example of that. Most of the questions that I get about pharm from people have to do with how do I answer questions when I have no idea what the drug is? Okay, so there's two things that you want to focus on. One is how do you know the side effects? And then how do you know the adverse effects? So as a general rule, okay, my strategy is that if the question is about a side effect and you don't know it, then you want to choose the option that's in the same system as the health alteration or the drug classification. Okay, so if it's asking for a side effect and you don't know the name of the drug, but it tells you about the health alteration, or you can figure out what the classification of the drug is, pick the option that matches that. And that works 85% of the time. The 15% of the time it doesn't work is because the question or the scenario doesn't have the health alteration and you don't know the drug classification. So then just guess. But so for example, if I gave you a question about sotalol or betapace, and I asked you for the side effect, most of you would know that because you know about beta blockers. So you just would pick the right answer. You don't need the strategy. But if you didn't know it and you wanted to ask and you needed to use the strategy, then it's a beta blocker. So it's a cardiac drug. Okay. And if I told you they had hypertension, that's a cardiac health alteration. So look for the answer as a side effect that is cardiac. So, and the answer is generally bradycardia. Okay. So that's the side effect one. The adverse one, you want to choose the option that is the worst assessment listed, irrespective of the health alteration or the drug classification. And of that 85% of the time that you're choosing, 85% of that it'll be a renal answer. Okay, so something having to do with the renal system. And that's because theoretically, most drugs are nephrotoxic or have some nephrotoxicity. Now, there are groups of drugs that we associate with nephrotoxicity, cephalosporins, autoimmune disorder drugs, immunosuppressants, those we associate that. But most drugs are metabolized and excreted through the kidneys. So nephrotoxicity tends to be, if someone's having an adverse effect, something that would be apparent. And so if you're unsure for an adverse effect, and one of the options is a renal option, pick that unless it's something that is very specific to a drug. So for example, an adverse effect of aspirin or salicylic acid is tinnitus. Okay, so even if there's a renal answer there, you know it's tinnitus. That's what you're going to pick. But if you aren't sure, if you pick something renal, or if there's no renal, just pick the worst thing there, you're going to get that right 85% of the time. And that'll alleviate some of your stress about answering pharm questions, which I think for most new grads is the most stressful thing, besides select all that apply, which you all don't like either. Oops, sorry about that. Okay, and then the last strategy is select all that apply for things that are select all that apply. Now, again, I always try to remind you that select all that apply questions are actually, and if you think about it, it'll make sense to you. They're actually easier than multiple choice questions in theory, because a multiple choice question, you have to know why one thing is right or why three things are wrong. In a select all that apply, you can think broadly and you don't have to think so focused and specific as to one thing. So on the boards, there's usually 6 options to choose from. It doesn't have to be 6, but that's usually what it is. It is usually, it's not none of them. Okay, you have to pick something. So there's not going to be an option for you to pick none unless it says none of the above. Don't pick that. Okay, because it's generally not going to be none. It's generally not going to be all, although there are some people out there that will tell you that the boards now says, yes, you can pick all of them, and you can, but generally it's not all of them. Okay, so that's an absolute also. And it's usually not one of them. So usually if you have 6 options, it's 2 of them, 3 of them, 4 of them, or 5 of them. Okay, it's not an exact science. Again, it works about 85% of the time, but that's better than no % of the time. Okay. Also, you want to think out of the box and really broadly. So you want to consider complications. You want to think about the broader system than simply the health alteration. So, you know, I use as an example lupus. If you get a question about lupus on the board, you want to think also about immune things. Think beyond just the one multiple choice option that you would normally look for, and think beyond the obvious. Okay, so again, if I use lupus as the example, and I picked that because everybody knows about it, if I were asking you to assess someone in a multiple choice question where only one answer could be right, most of you would be looking for something about the butterfly rash, because that's the assessment that we look for, okay, in patients who we suspect or have been diagnosed with lupus. Okay, but on a select all that apply, you might have that, or you might not have that at all. But then you have to think, oh, well, what else am I going to look for? And if you don't see butterfly rash, again, you panic. Oh my God, they didn't teach me this. I don't know that. I hate this person because they didn't. Forget all of that. Again, take a breath and then just think, okay, lupus is an autoimmune disorder. What autoimmune things are here? Okay, it says fever. Okay, that's our immune response. Pick that. Okay, they don't have butterfly rash, but anybody who gets a rash anywhere on their body, their skin can be dry. It can be flaky. It can be itchy or pruritus. So think about those things and then pick those answers. And you're going to be right about 85% of the time. So it's think broad. If there's a complication, think about that and then look for the assessment or whatever it is they're asking you relative to that. Okay, so that's select all that apply. Okay, I already did that one. Okay, so now here's some practice questions. So my disclaimer on this is some of these are my original practice questions. Some of these are practice questions that I've adapted from work that I did initially with Linda Silvestri, who writes the Saunders books. I wrote for her in 2009, 2010, 2011. I've updated for her since then. But some of these questions come from some work that I did for her. And I used to write faculty edition books of Saunders for Linda Silvestri. So some of the questions are from them. So, you know, these are questions that have come from those sources, and I've modified them or I've updated them or so forth and so on. So that's some of these. If we don't get through them all, I think I put 25 questions on here. You can answer them after the webinar is open if we don't get through them all. If you want to know if you're right or wrong, you can either look it up, or you can send me an email, or you can message me on one of the social media platforms that I'm on, and I'll give you that information at the end, and I'm glad to answer them for you. It was just to give you extra practice. Okay, so these questions with the asterisk next to them, we're going to have you actually answer and see how you do. So question 1, Megan. Okay, so the question is, a 2-week-old infant is seen in the pediatric clinic for a well baby visit. The assessment of most concern to the nurse would be strabismus, harlequin sign, Epstein-Pearl, or umbilical erythema. Okay, so choose your answer. Okay, so 9% picked strabismus, 23% picked harlequin, 2% picked Epstein Pearl, and 66% picked umbilical erythema. And those of you that picked umbilical erythema would be correct. Okay, so how do you get this, and what are these things? And how can you answer this question even if you don't know it? Okay, first of all, you have to know what all these things are. I put this question in because a lot of these words people don't remember, or they don't know what they are. And so to some people, they all sound bad. Okay, so strabismus is cross eyes, and that is very common in newborns. Their eyes don't settle because their eye muscles haven't well developed yet. So it is common to see strabismus in a 2-week-old. So that is not concerning. Let me skip B for a minute because that was the other big one. Epstein's pearls are just those like little pimple-like lesions that you sometimes see in newborns. They can be in their mouth. They can be sometimes around their mouth, and they're normal. Okay, they will go away on their own. There's nothing that you need to do. And so that one is out. So if you could get rid of those two, which it looked like most of you did, you're left with B and D. Okay, so if you didn't know the answer, you absolutely didn't know the answer, you have no idea what harlequin sign is, you don't know anything to pick the answer that has a word that would normally indicate to you that something is wrong. So erythema is hot and red, which generally indicates an infection. So if you're stuck between B and D, again, this is my linking or conceptualizing. Look at what is there and what do you know about it that can help you? Well, we know that patients who have erythema may have a risk of infection. So pick D if you're not sure, and you would have gotten the right answer. Okay, so harlequin sign is normal. Harlequin is like a clown. It's when you have newborns and you turn them from side to side and they're blue on one side and more pink on the other, and then you reverse it and then they're pink and blue. And that's because their cardiac system and their circulation is still not well developed. And so a lot of times when you turn them on their side, you'll start to see that they get cyanosis. It's just because they're not getting good blood flow out to that side. And then if you switch them back, the colors will change. So it's like a harlequin. So if you think about a clown that's got blue on one side of them and red on the other, that's what harlequin sign is. And that's normal in newborns. So the right answer is umbilical erythema, and they may have an umbilical infection because generally from something that happened during the cutting of the cord. So that's the correct theoretical answer, but you could have gotten this by just using the word erythema. Okay. Okay. Next one. Okay. So we're going to have you answer this one too. So hang on until it switches over. Now, if you've been on a call with me before, you may have seen this question before, but go ahead and answer it anyway. Erythromycin is prescribed for a client with otitis media to ensure optimal absorption. The nurse says to take the medication on an empty stomach, immediately after a meal, with a snack such as peanut butter and crackers, or just before eating. Okay, so again, a good spread. So if I were evaluating myself, okay, I want all my options picked. Okay, so here we've got erythromycin, and when do you give it? So 51% on an empty stomach, and then the rest of you between after a meal with a snack or just before eating. Okay, so the correct answer is A, or on an empty stomach. So if you picked that, that's great. If you didn't, theoretically, I'll tell you the answer and then how you could answer this. Okay, so most antibiotics, and for that matter, most drugs that we would give in practice can be given with food, most of them. There are exceptions to the rule. Erythromycin, which is also called EES sometimes, erythromycin is an exception to the rule antibiotic. It needs to be given on an empty stomach for maximum absorption. So that's the theoretical answer for why erythromycin is on an empty stomach. Okay, and there are not a lot of antibiotics that you see that are given on empty stomachs, particularly in kids. So if I made most of the time otitis media is seen in kids, but I didn't put that there because I didn't want you to focus on the age. The other three options all are associated with a meal. So if you didn't know the answer, if the other three options have something that is similar or in common, eliminate them all, because this is not a select all that apply. It's you got to pick one answer. So if you can only pick one, immediately after a meal has a meal attached to it. So that's food. With a snack has food. And just before eating is going to be associated with the med going with food. Then those three all can't be right. How are you going to pick between them? Get rid of them all, and you're left with A, and you would have gotten the right answer. So how do you do this? Remember, the way that you get better at using these kinds of strategies of mine is to practice with them. If you get stuck on a question on a practice test and you don't know the answer to something, then use the strategy to practice. You don't want to go take the boards and then the first time you try to use any of these is when you're taking the boards, because it's going to take a lot of time and you're going to run out of time on your test. So this is an example of, if you knew it, erythromycin is the exception to the rule, it's on an empty stomach. If not, B, C, and D are all too similar. Get rid of them all, pick A. That's the right answer. I could change the drug and I could have made it Synthroid or levothyroxine. That would have been the same thing, because levothyroxine also has to be taken on an empty stomach because of the absorption, because you want it to work on the basal metabolic rate. Okay, so another example of that. Okay, question 3. And as this is flipping for you to do the poll, let me remind you, if you are missing things now, it doesn't matter. That's what practice is for. Don't beat yourself up and don't say, I'm supposed to know it, I'm supposed to know it, I'm supposed to know it. Who cares? You practice to get better. If you're going to miss them now. And then you learn from them. Okay, question 3. A client will receive long-term continuous total parenteral nutrition at home. The nurse formulates a priority diagnosis of ineffective coping, hopelessness, social isolation, or risk for situational low self-esteem. Okay. Okay, so we've got a good split again. Okay, so the correct theoretical answer is social isolation. Okay, so how do you figure out the answer to this? This would actually, for those of you that have heard from faculty or people that you know that say, some of the questions are harder than others on the boards, this would have been considered a hard question on the boards, because you have to really critically think and you have to sort of take it out to different areas. So a person, first of all, you have to understand what TPN is, otherwise you can't answer this question. So remember that total parenteral nutrition is given to patients who need nutrition that can't get it orally. Okay, and so cachexic patients that are have vomiting from chemotherapy, that have other issues with their GI system, or are burn patients where you need to give them a lot of calories. So total parenteral nutrition is that solution that is packed with calories, and the calories comes from the sugar in it or the glucose. So if you've seen people that have TPN that has been hanging, or you read about it in a board review book, often it'll have D10, D25. So there's a lot of glucose in it. And so the priority nursing intervention is to make sure that you're preventing infection, because there's so much sugar that, if exposed, will grow bacteria. And because of that, knowing TPN, knowing it has a lot of glucose in it, then you need to know that the patient is going to have to be without visitors or without a lot of visitors. And particularly because I said this patient is at home, they're not going to have isolation garb at home necessarily. They're not going to have PPE at home necessarily. So we would generally, as a home healthcare nurse or a nurse that had been discharging them, tell them that once they're home and they're getting their TPN, they should limit their visitors, because the more people they're exposed to, the greater risk there is of them developing an infection, because they have TPN hanging and it has glucose in it. So that's theoretically why social isolation is the correct answer. And if you got that right, that's great. If you didn't, then again, just look at the other options as you're reviewing and say, okay, well, what in that scenario gave me any indication that the patient was not coping effectively? Nothing. You're assuming that they're not going to be coping. You are assuming that they might be hopeless. You are assuming that there's a risk for low self-esteem, because there's nothing in there that tells you that. So then someone might say to me, well, I'm assuming that they're going to get social isolation. That's not an assumption, because it's based on the information that the patient is getting TPN. So the nurse's responsibility would be to inform the client that while they are at home getting their TPN, they should have limited visitors. And that's how you get that answer correctly. Okay, question 4. Okay, you're going to answer this one as well. The nurse is assessing for the presence of jaundice in a client. The nurse checks what area or assesses what area for the jaundice. So the soles of the feet, the back of the hands, the conjunctiva of the eye, and the earlobes. Okay, excellent. Okay, very proud of all of you. Okay, this is a common question that people make mistakes on all the time. And again, if you're nervous, you tend to jump for what I've seen in clinical rather than what you know to be theoretically correct. Whenever you're looking for color changes in patients, whether it's cyanosis, whether it's paleness, whether it's jaundice, whether it's hyperemia, which is really red, you look in the conjunctiva or the conjunctival sac, okay, the mucous membranes, okay, the sclera. Look in those areas. Don't pick any area of the body that is associated with the skin or the skin color, because color changes look different on everybody. So if I made this patient, if I said that this was a Caucasian patient, that would be different than if I said this was a Black or an African American or a Caribbean American or whatever, a different kind of patient than Caucasian, which would be different than an Asian American patient or somebody else. And remember, Caucasians are not all the same color either, just like African Americans are not all the same color. There are different colors that are associated with one's skin, and it's hard to see color changes in all of them. Okay, it's irrespective of what color your skin is. So you want to pick things like the sclera, the conjunctival sac, the mucous membranes. That is an example of one of those easier questions on the boards. This is not something that you want to miss if you get a question like that. And the reason that most people miss this question on the boards, if they get it, is because they're thinking what they see in practice, not what is theoretically correct. And we have nurses all the time and other healthcare providers all the time that look at the earlobes, they look at the nail beds, they look at the back of the hands or the soles of the feet, and those are all incorrect. Okay, question 5, which is going to be the last polling one. Okay. So a child with hemophilia is in the emergency room after being hit in the neck with a baseball. The nurse should immediately assess for spontaneous hematuria, airway obstruction, headache, or slurred speech. Excellent. Okay, so the correct answer is airway obstruction. So for those of you that picked that, you followed priority setting, which is A, B, C, okay? Child is hit in the neck, airway obstruction is the A, okay? It's the airway, and it's also a breathing issue. Most people, if they don't pick that, focused on the hemophilia, which is why you went with the hematuria. So if you are the person or people that picked hematuria, that's the reason, because you saw hemophilia and you gravitated towards, oh my God, they're going to bleed out. And while they may get hematuria at some point, that's not the priority. Even though you may have associated that with the C for circulation, it doesn't come in front of airway obstruction. For those of you that picked headache or slurred speech, you just focused on the fact that the client was hit with something in the neck and you were thinking neuro because its head and neck is neuro. And those are all good reasons in a practice question to pick it. But this is an example of why using that Maslow priority setting is so important because, excuse me, the word immediately, what do? They're hitting the neck. That's their airway obstruction. Okay, so that's the reason that number 5, for number 5B, or airway obstruction, is the correct theoretical answer. Okay, the rest of these are not going to be polling because I wanted to try to get through as many of them as I can. So I'm going to read them and give you an opportunity to answer them on your own, and then I'll go through them with you just so that you can see some different things and where I can point out strategies or ways to answer questions. So this is a nurse suctioning a client through an endotracheal tube, monitors the client for complications of the procedure. Which of the following assessments indicates a complication? So A is blood pressure of 138/88. B is an irregular heart rate. C is a reddish coloration in the client's face. And D is pulse oximetry of 95%. Okay, so I'll give you a minute to sort of answer it on your own, okay? And then I'll give you the answer and explain it to you. Okay, so in this question, as you're reading the question, the key word was complication. Okay, you're looking for a complication. It doesn't say look for something that's abnormal in just the grand scheme of things. You're looking for a particular complication. If you picked A, blood pressure of 138/88, that's, a lot of people pick that, but that's not by definition hypertension. So yes, their blood pressure may be high, but it's not a complication because it's not elevated to the point that it would be diagnosed as something that there's wrong with them. Yes, it's elevated. And if I put in the scenario that their blood pressure before was like 120/70 and now it's 138/88, that would change how you might answer the question. But for now, that's not even considered hypertension. So that's not the right answer. B, an irregular heart rate, that is the right answer. So I'll come back to that one. C, a reddish coloration in the client's face, that's normal. You get that when you suction someone's endotracheal tube. And you generally get that when you suction anybody in the head and neck area. You're going to get sometimes a reddish coloration. Sometimes you might also see, if you're doing a trach, you might also see cyanosis because you're pulling out oxygen as you're suctioning them. So a reddish coloration is normal. So that's not a complication. And then a pulse ox level of 95% is also, that's normal. It's not a complication. Again, if I wanted to change it and I said that their O2 sats have been running 100% and now it's 95, you may think, oh, well, maybe there's something wrong. But in theory, there's nothing wrong with that. So an irregular heart rate is a complication. We do not expect to be suctioning patients in any tube where the result is an irregular heart rate. People should not get sinus tachycardia, sinus bradycardia, or any other kind of changes in their heart rate just simply from suctioning them. So B is the right answer, theoretically. Okay. 7. Okay, a nurse is assessing a child with consolidated pneumonia. When auscultating the child's lungs, you would expect to hear A, crackles in the affected lobar lobes, B, interstitial breath sounds in the affected lobar lobes, C, wheezes in the affected lobar lobes, or D, no movement in the affected lobar lobes. Okay, so answer that one. Now on the boards, while you're answering this, on the boards, if they wanted to make this an alternative format question, they could actually have you put on a headset and have you listen to lung sounds and then pick the answer that way based on what you were hearing. Okay, there are not a lot of auditory questions on the board, so don't worry about them. Don't freak out about them. Most of them have to do with, can you pick a murmur? Yes or no. They have one or they don't. Lung sounds, crackles, bronchi, or wheezes, vowel sounds. That's generally what they are, if you were to get one. Okay, so in this question, you're looking at consolidated pneumonia, and then what would you expect to hear? Okay, so the correct answer is no air movement. Okay, so D is the right answer. So if you pick D, you are correct. Okay, if you picked any of the others, this is the reason they are wrong. First of all, consolidated pneumonia, consolidation means there's a mass of usually infected bacterial or viral infection that's sort of compact. So if you think about just the term consolidation, it means to compact everything. And so where you have a lot of pneumonia that's compacted or pressed together in a portion of the lung or the entire lung, air can't travel through a mass. Okay. Now, when I use the word mass here, I'm not talking about a cancer. I'm just talking about a lot of bacteria, a lot of virus, even a lot of fungal infection that's sort of pressed together or compacted together in one part of the lung or the entire lung. And so you don't hear air movement through there. Air can't travel through that. If you picked any of the others, then you are assuming that you can hear air movement, and that's how you can hear the breath sounds, the crackles, or the wheezes. Usually, in someone who has consolidated pneumonia, once you start to give them antibiotic therapy and the pneumonia will start to break up, or the organisms will start to break up, then where they can hear or where you can auscultate the air traveling through that breakup is generally where you'll start to hear crackles first, because there's fluid in the lungs. And so a lot of times, if I changed it and I said that you're treating the patient with antibiotics, how do you know the antibiotics are effective? What would you be auscultating? Then you would probably pick crackles for that. Okay. But anytime that you have someone with pneumonia and they put the word consolidated, okay, there's going to be no air movement in that particular area. Okay. 8. A nurse is performing a medication assessment on a client being seen. I didn't type this well. I apologize. They're there for an initial clinic visit, and in the history it says that the client is taking terbutaline or brethine, and ask the client about a history of what. So the nurse needs to know, based on that medication, what is the client, what is their history of what disorder. Okay, if they're taking that medication. So you've got ulcerative colitis, congestive heart failure, asthma, and rheumatoid arthritis. Okay, so the client tells you they're taking terbutaline or brethine. What in their history related to what disorder would you ask them questions about? Ulcerative colitis, congestive heart failure, asthma, or rheumatoid arthritis? Okay, so the correct answer is C, asthma. Okay, now there's a couple different ways to answer this question if you didn't know the answer, and a lot of people don't, which is the reason that I used it, so I could use it as an example. Okay, first of all, here's a Marshall trick. Okay, I call it Marshall strategy. Some of my people that I work with call them Marshall stupid tricks. I don't think they're stupid. I think they're very smart. But when you see sometimes in the names of the words of the particular drugs, a lot of times they'll give you a hint as to, just by the name, of what they might be used for. So in this one, brethine, breath, pick a respiratory answer, you're going to be right. So brethine is for asthma. That's a trick. It's a strategy to use if you don't know the answer. And remember, you can link to anything. You can find anything that will help you answer a question. So brethine is used for asthmatics in order to open up the airways and to allow the patient to have or facilitate more effective breathing. If you didn't know it that way, you could go through the other options and say, okay, well, what do I know about them? So most ulcerative colitis patients take steroids and they might take antibiotics. Okay, steroids end in SONE or ONE, that's not this. And antibiotics, most of you know what different kinds of antibiotics end with, and that's not there, so get rid of A. B, congestive heart failure. Almost everybody knows that patients with congestive heart failure are taking Lasix or furosemide and DIG. Not there, get rid of that one. Rheumatoid arthritis. Most patients that have rheumatoid arthritis are, again, taking steroids, no SONE or ONE drugs. Some of them may be taking autoimmune disorder drugs. Usually most autoimmune disorder drugs have immune or some version of that in them. Not there, get rid of that. Then you get the right answer, you didn't have to know it. Now, how long is it going to take you to do that on the boards? That takes time. So the way that you get better at this is by practicing, by looking at questions and seeing how you can get better at answering them by knowing, again, excuse me, if you don't know it, what do you know about the others to get rid of it? And then last man standing or whatever's left has to be the right answer. Also, terbutaline is also a medication that you can see used in premature labor. You might also see that as a question in a practice book relative to preterm labor or maternity. Okay, so asthma. Okay. Question 9. I'm going to skip that one. Hang on. Okay, let's do this one. A nurse notes swelling and excessive bleeding on the dressing of a client who underwent an enucleation. And so based on that finding, which nursing action is most appropriate? So A, document the finding. B, reinforce the dressing. C, mark the amount of staining with a black pen and continue to monitor the drainage. D, notify the surgeon. Okay, so in this question, if you didn't know that the surgical procedure was the removal of the eye, you could still answer the question. Okay, lots of people, you're going to see lots of things on the boards where there's going to be words you don't know. And just to remind you, there would be words on the boards that I would not know either. Okay, so there is nobody who knows everything. Don't panic. Don't panic. Okay, if you don't know something, read it again. What do you know? Okay, so you know there's swelling and excessive bleeding. That was the key, the excessive bleeding. Yes, Patients who have surgical procedures are going to bleed after surgery, and they're going to get blood on their dressings. That is expected. Okay, but the fact that it is excessive is call the doctor. So this is an example where you call the doctor because there's no other information that's given in the 4 options that the physician would ask you. So you're not just going to document it because the patient's going to bleed out. You're not just going to reinforce it because you're basically ignoring the fact that the patient is having excessive bleeding. And you're not going to just mark it and keep monitoring it because, again, it's excessive bleeding. If it just said a small amount, that's different. But the word excessive is what drives you to say, I need to notify the surgeon. Okay, so this is an example where you do pick it because there's nothing else that the physician would be asking you that is an option for you to choose. Okay. Okay, I'm going to flip through these real quick and find one more question, and then I'll open it up. And if we go a little over, as long as it's okay with Erica and Megan, it's okay with me. Okay, I'm going to do this one. A nurse just finished suctioning the tracheostomy of a client. The nurse evaluates the effectiveness of this procedure by assessing which of the following. Okay, respiratory rate, O2 sat, breath sounds, apical pulse rate. Okay, so you just finished suctioning the tracheostomy of a client. Okay, so what are you going to do to evaluate the effectiveness or non-effectiveness of the procedure? Respiratory rate, O2 sat, and by the way, on the boards it always says oxygen saturation level. It won't say O2 usually. Breath sounds, apical pulse. Okay, respiratory questions on the boards, if you get them, tend to be of the system kinds of questions. They tend to be the ones that most new graduates, if you're going to miss something, miss, because your go-to answer is always to check the oxygen saturation level. O2 sat doesn't tell us if suctioning was effective. O2 sat tells us about how well patients are oxygenating themselves. So if you were giving oxygen to a patient, then you would check the oxygenation saturation level to see if that was working. But it doesn't tell you if somebody is effectively had a suctioning of their tracheostomy completed by you. So B is wrong. Respiratory rate also doesn't really tell us about suctioning. It tells us if someone has effective or ineffective breathing patterns. So you don't really pick respiratory rate for suctioning. Apical pulse doesn't really tell us anything about this. So that was the first one to get rid of. So the answer is breath sounds. You listen before, just think about how you do it. In theory, and this even is the same in practice, you auscultate their lungs before. That's how you determine if someone needs to be suctioned. You suction them, and then you auscultate again. So breath sounds is the correct answer. 9 times out of 10, people pick O2 sat for this answer. Okay, so remember, if you're looking at positioning, does changing one's position help with breathing? That's respiratory rate, because respiratory rate tells us about breathing patterns. If you're looking at oxygenation, ABGs, O2 sat is related to that. How well is someone being oxygenated? If you're looking at suctioning and is it effective or non-effective, then you're looking at breath sounds. Okay, so those are some examples of different kinds of questions. So there's like 13 or 14 more questions that are there for you. You can go through them. And again, I'm going to flip through all the slides now just so I can get to the end. And then you can figure out how to get them to me if you want to know. Now, there's a couple things. And then I'll answer questions if you have them. First of all, if you are a Sigma member on the call, you can go on the circle. And if you don't know how to get to the circle, just go on the home page, go all the way down to the bottom, and where it has all the little categories of things, it'll say the circle. Click on that. And then when you click on it, it'll ask you to log in, use your login information, and then go to where it says groups. There's a tab that says groups. Go to the group that says Career Advice Forum, and you can post a a question to me there, or you can email me from there if you want to do that, okay? If you are not a Sigma member, okay, and that's fine, because we opened this up to everybody, then you can get me either by my email, which is LSM, and it doesn't have to be capitalized, 4556@AOL.com. Just put in the subject line that you were on the Sigma NCLEX webinar, or just put NCLEX webinar so I know. If you're on Twitter, you can follow me at NCLEX, which is capped and then prof. If you're on Facebook and you like that better, you can just find me at Lois Marshall. There's a lot of Lois Marshalls apparently, so you want to be looking for one. There's a picture of my Yorkshire Terrier and a career book. So you'll see that there, it's orange, so you'll know that's me. And if you're on Instagram, if you like that better, then it's also at NCLEX Prof. So you can message me, you can post. If you want to openly post it, that's fine, or you can just message me in any of those ways. I don't mind email, that's fine too. And you can answer the other questions and you can send me the answers, or you can look them up. And if something doesn't make sense to you, you can ask me, and I'm glad to answer any of that information for you. Also, once this is posted in the repository, I'll work with Megan and Erica to put up this handout of mine that is going to say NCLEX test taking, I think it says test taking strategies by Marshall or something like that. It says test taking strategies assistance sheet. And that'll have the things that I talked about at the beginning with some examples of things. You can use those if you want. The only thing that I ask is that please don't repost my stuff on your social media sites, okay? Because it's mine, it's copyrighted. I don't mind giving it out to people, but I like to be the one that gives it out. So, and then if you have questions about that, you can ask me that as well. And with that, Megan, we can go with questions, or Erica, whoever's doing that.
We just have a few questions.
Okay.
I have one about select all that apply. Can you choose all the answers on select all that apply?
Okay.
Or what are strategies for those select all that apply questions?
Okay, so as a general rule, my best advice as an NCLEX expert is it is more often not all of them. So you can pick all of them. It does allow you to do that now. There was a time that you couldn't. Now it does allow you to choose them all. And my best advice is always, is as a general rule, is because things are not always all the same or always right. If I were taking the test, so I'll use me as the example. If I were sitting and taking the boards today, I was answering a select all that apply, it would be very difficult for me to pick all of them. So I always tell students, try not to pick none of them and try not to pick all of them. Now, that being said, if you know, you go through them and you say, oh my God, they're all right, then pick it. You know, that's what you base on your critical thinking skills or your knowledge set, you might do that. But if you are unsure, I always say err on it not being all of them.
On ranking questions, what strategies do you have for those?
So I'm all about, linking information. So for example, if you're practicing and you have a question about, say, I'll use the example that I generally use when I do this. And if you've heard this before, I apologize, but it's just a good example. If you were in school and you learned about hypertension in your first med surg class, so you learned about hypertension and you learned how to manage the patient in hypertension, okay? And all is good. And then you go to your next med surg class, med surg 2, critical care, whatever it happens to be, and you learned about hypertensive crisis, and you learned how to manage the patient in hypertensive crisis, then at some point you should have learned, besides changing their position, raising the head of the bed, looking for changes in respiration, looking for changes in nausea and vomiting, looking for changes in maybe their pupil patterns or pupil deviation. Besides that, you would have also learned that they need to get antihypertensives IV, so don't pick PO, antihypertensives IV, and you want to be monitoring the client for seizures, okay, and for stroke. So anything having to do with seizures and stroke. So when you link that information and the question's about hypertensive crisis and you're saying, oh, and maybe they're giving you a list of drugs and you go, oh my God, I don't know, why would I be giving Ativan or lorazepam to this patient? It's in order to depress the central nervous system because this patient is at risk for epilepsy or a seizure. So it's linking back to what you know. How do I manage that? Okay, so that's one way. The second way is you've now learned about hypertension, hypertensive crisis, and now you go to maternity and you learn about pregnancy-induced hypertension. So pregnancy-induced hypertension is a hypertensive crisis. The difference between the two of them is in a hypertensive crisis, we may not necessarily know why they get it, but in pregnancy-induced hypertension, they get it because they're pregnant. Okay, so if you were answering a straight off, what's the drug of choice for someone with pregnancy-induced hypertension? Everybody would be running to find mag sulfate or magnesium sulfate because that's the drug of choice. If I wanted to help you link or use that information for one of these others, remember, magnesium sulfate has two primary purposes or two primary functions. One is to depress the central nervous system, okay, which is to prevent them from having seizures, which takes them from preeclampsia to eclampsia. And the other is it vasodilates them to bring down their blood pressure. Okay, it relaxes smooth muscle, brings down their blood pressure. So in essence, if I went back and I asked you a question about a hypertensive crisis, and say I gave a name to it, like autonomic dysreflexia, which is a hypertensive crisis in a spinal cord injury patient, and I gave you a bunch of drugs, and I said one of the drugs to pick was mag sulfate, or it was a select all that apply and had drugs in it. Most people who don't see information as combined, you look at things as a silo. I memorized it for this, I memorized it for that, and you don't learn it conceptually, would say, oh, well, mag sulfate is for pregnancy-induced hypertension. Why would I use it for an autonomic dysreflexia patient? Because it's not a maternity drug. It's a drug that depresses the central nervous system and relaxes smooth muscle. So yes, you could use it for someone with autonomic dysreflexia. You could use it for someone that had any type of hypertensive crisis. Okay? And if the patient was a psych mental health patient and you were giving them MAO inhibitors and then they ate something with tyramine and they got a hypertensive crisis for that, you could use mag sulfate for them as well. So it's taking information and using it for other things than that one thing that you might have memorized it for. I'll give you one other example. So remember, you've learned hypertensive crisis like 5 times in nursing school, and it's the same for everybody. One other thing, if I were to tell you to do an assessment of a patient who has chronic obstructive pulmonary disease, and the question was about doing a respiratory assessment of that patient, and maybe I gave it a name and I said they had emphysema or they have cystic fibrosis or they had chronic asthma. Those are all 3 examples of COPD patients. If you know how to assess the respiratory system of someone with COPD, you know how to assess the respiratory system of every patient that you take care of. Are there going to be differences? Yes, they're not going to have necessarily clubbing of the nail beds in someone who has bronchitis. They're not going to be barrel chested in someone who has bronchitis. They're not going to necessarily have pursed lip breathing in someone who has bronchitis. But overall, the respiratory assessment is the same. So you take the information that you know and you link it to something that you didn't necessarily think about, rather than trying to memorize every single thing. And so for that reason, I tell people at every time I teach this, do not pick up a board review book and read it from cover to cover, because all you're going to be doing is relearning a lot of the same things over and over again, like in the hypertensive crisis example. In pre-op teaching, it's the same for everybody except the actual surgical area. So those kinds of things, instead of memorizing it, use the linking of, I know this, what else can I use this for? And then you're expanding your knowledge base and your ability to critical think without memorizing every single thing in there.
Thank you so much to our presenter today for this great information. Sigma is grateful that you took the time to share with this audience, and we look forward to hearing more from you in the future. Be sure to check out Sigma's upcoming webinars, podcasts, and resources to support you and your colleagues at sigmanursing.org. Also, previously recorded webinars and podcasts are freely available on the Sigma repository. Thank you for joining us and have a wonderful day.
And please keep in touch.